Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi. And this episode is everything you need to know about sex and sexual history taking and the biopsychosocial model that we talk about in sexual health. Before I get into it, the first thing I want to make very clear is that we are not giving any type of religious or medical advice. So if you have any concerns about your health, please speak with your medical provider. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. And this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I am so happy and grateful to have on with me Uchenna Ossai. And UC, as people lovingly call her, is a doctor of physical therapy and pelvic floor therapist, but does so much more than pelvic floor physical therapy. So welcome, and please introduce yourself, and we'd love to know more.
Well, thank you. First of all, I'm so honored and just happy to be here to chat with you about all things sexy time and health. So it's my favorite topic. But yes, I currently, I've been on faculty at University of Texas at Dell Medical School as assistant professor for about 5.5 years up until August. And now I'm with the University of Utah in their College of Health as assistant professor in their Department of Physical Therapy. And my specialty, yes, is in pelvic health and sexual dysfunction, but also how to implement, equity, diversity, inclusion, intersectionality into the learnings, right? Because we know that social determinants of health, political determinants of health are 80% of everyone's health. And what we do as healthcare providers is about 20%. And so making sure that we all understand our health, not just from a biological perspective, but from a global perspective, and what are the upstream problems and what are the downstream problems, and how to navigate that as whole individuals. And of course, centering everyone's humanity. That's key to being a human, but also being a provider for me.
That is awesome. Yeah. So I had the privilege of having listened to your lectures while in my course for sexual counseling and education through the University of Michigan, and they were amazing. And a lot of the things that you talked about were focused in the model of the biopsychosocial model and aspects of a person's life in regard to sexual history. And I'm wondering if you could break that down a little bit for our viewers and our listeners.
Absolutely. And let me talk to you all about it from the perspective I had before I started grad school, right? Before I started my doctorate. I was 23 years old, and I thought to myself, well, this is how I think of my health. My health is, that I do yoga, that I exercise, that I eat right, that I get a good education, that I be in a safe neighborhood, right? And so that's what I thought of when I thought about my health and what made up my health. And that was many years ago. I'm not going to tell you how many, but it was many years ago. And so I very much had a biomedical view of my health. So it was either my health was wrapped up into the biological, like if I had cardiovascular disease or anything like that, and that was due to my choices, right? My personal choices. And then of course a little bit with some genetics, right? That's how I thought about it. And that, and I would be healthy once I addressed that issue. The biopsychosocial model is a departure from that. I call it a departure, or we can think of it as an additive. It's looking at our health, yes, from a biological perspective. So we have the things that are going on in our life: endometriosis, erectile dysfunction, pain, hormonal imbalance, whatever is in that bucket. But then we also have to look at it from that psychological perspective. What's happening to us emotionally? right? Do we have a history of trauma? Do we have anxiety, right? Do we have depression? Are we dealing with significant amounts of shame, whether that be, body shame, cultural shame, you name it. And then you also have to look at it from another line of, the sociocultural components. Our gender, right? Our religion, our race, right? Our sexual orientation, how society frames us, right? Those are going to help inform how we look at ourselves from a sexual perspective, how we look at how policies are made to kind of allow us to express ourselves in any way we can. And then the last bucket is going to be the interpersonal component, right? So our relationships with others, our relationship with ourselves at work, right? Are you kind of functioning in a toxic work environment all day every day, and then you have to come home to family and other responsibilities, so you're constantly in this space where you're not able to, you're just surviving.
Yeah.
And then that survival does have neurophysiological components that do impact your stress level, that do impact your erectile function, your vaginal function, your bowel, your bladder. So all of the things. So it's really what I think of the biopsychosocial framework as a inclusive, informative, healthy way to look at our health, particularly our sexual health, and all the players that are there. Because sometimes we can be, not to any fault of our own. The only script we've been taught is we're very tunnel visioned. It's either get this med, get this hormone, which might actually, you might need both, but there are also other pieces to it that'll help you have a more, how have an even better improved outcome.
You're absolutely right. I think that, medicine as we know it is all about pathology, right? So we go in, there's a dysfunction, we get treated for that dysfunction, and that's it. And that really, it's hard to blame anyone just because it's the way that our medical societies are based, or even like our medical offices, right? We just don't have enough time. There's not enough time to sit down with a patient and ask them about everything that's going on. So I think the way that you do it, where you incorporate all those different aspects, when you're doing a consultation, I think are so important, because then you get the whole picture of the person and you just don't see the problem. And then you look at all the different ways that you can help and nurture that individual.
I agree. I really love that you brought that up about the time crunch, right? And the way that even we train physicians, nurses, PAs, PTs, it's
Right.
it's very time crunched, and it almost gives us this not necessarily myth, but this misconception that we are alone in this battle for to help our patient. And that's why when you're thinking about complex, particularly sexual dysfunction and complex pelvic floor dysfunction, the gold standard is multidisciplinary care. You may be in a siloed clinic, but having that dream team of individuals where you may say to your patient, they might bring up at the last 30 seconds of your session, oh, by the way, I have significant orgasm problems.
Yeah.
Right? And so it's helpful for providers to know, to say, okay, so listen, I want to hear about all of this. And you and I have about 2 minutes left, but let's make an appointment to discuss this in a later date. But in the meantime, I'm going to set you up with this person and this person to help you further investigate. And then I will be part of this discussion as we bring in these other people to help you with your goal.
Right.
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 And that, I think having that plain discussion, because we want to be able to kind of just scoop everyone up and under our wing and protect them and address their needs. And sometimes you're just like, oh, darn, like I only have 10 minutes. And this is a very complex thing that deserves time, deserves investigation, and deserves resources.
Right.
But the system isn't designed to make that easy. And when you think about ways to intervene, and it's giving us as providers tools to kind of better communicate to our patients, while also in that communication of time limits, we can also validate their concerns.
Right. Right. You had talked a little bit about in the lecture that actually I was lucky enough to hear, about like sexological systems, and maybe you could just talk a little bit about that and tell the viewers what that means.
Yeah, so sexological systems is one of the many approaches you could use to assess to assess sexual health, right? And so they divvy it up into about 5 systems. So you have the exosystem, which is going to be school, healthcare, media. What are the messages you get from that? And then you have the macro system, which is the society's messages, gender roles, religion, culture. And then as well, you have the chrono system, which is the events that happen throughout time. You have
Mm.
the mesosystem, which is your environment, what you're hearing hearsay about sex. And then the microsystems are the interactions with other people, your parents, your partner, biology, or that one sexual event, right? So a microsystem question that a provider might ask is, how do you know physically when you are aroused, right? A mesosystem question would be like, does stress impact your desire? An exosystem question could be, has contraception been readily available to you? A macro system question would be, what did you learn about the initiation of sex? Is it okay to have sex before marriage, or is it okay to have sex for pleasure? And a chronosystem question can be, have you ever had any sexual dysfunction prior to now? What was your first sexual experience? Was it positive? Was it negative? And so that's, as you see, there's the different types of questions I ask, and they're addressing different parts of the psyche and the systems that are at play. And it's very helpful. I mean, you could give this to patients and clients as a homework assignment. It could be directed by you, the provider, but it also helps people to understand what brings them, what is making up their sexual understanding of themselves. And it gives us permission to know that we're not supposed to know it all when we get married. We're not supposed to know it all when we finish high school. We're not supposed to know it all when we finish college. It's supposed to be an evolving process.
Yeah. That's great. It's almost like there's, layers of an onion, right? That you're peeling apart and you're trying to figure out and, what's going on. And I love the fact that you just said, we're not supposed to know it all
Mhm.
because I think that, you know, so I'm an intimacy coach. I'm a sex coach, specifically for Muslim women.
Wonderful.
And, I think that a lot of the hangups that, we have, being in a conservative culture, but it really, I think with all women, or with all people, is that we're under the assumption that we're supposed to know everything, right? And how do you even learn everything? It's through experience, it's through reading, it's through learning, it's through listening, and that's how you get your information. But I think that some of the negative thoughts, then the intrusive thoughts come in that, oh, like I'm not good enough, or I don't know enough, or, I don't have enough experience, or, all these thoughts come in and it just makes us feel less than when, I think it's so validating to hear from you that, you're not really supposed to know everything.
No, no, my goodness. I don't know everything. And I've been doing this for a long time, over 10 years. And I think the permission we need to give ourselves, um, part of that has to be the learning. We're all students of life, just in the general sense. And so for students of life, we're also students of sex throughout the lifespan. Because we're not going to be experts of our sex lives at 40, we're not going to be an expert of our sex life in our 80s because it's going to look different.
Yeah.
And that's going to require, and I think the concept of erotic intelligence and sexual intelligence is this is where that comes in, where it's you're not just born with it, it's built through experience. It's built through being inquisitive and being flexible and learning and exploring, and which is a beautiful thing. I often like to work with my clients in giving themselves that permission and saying, what can make you sexually fulfilled, is actually just the process of exploring
Yeah.
that journey. And I know that sounds a little cheesy, but it is actually true. But that's not the messages that we're told in society. We're everything is performative based. A lot of things are performance based and role based. Even the way we talk about pleasure or orgasm or erectile function, And I'm like, I would love to have conversations, more robust conversations about arousal. I would like to have more robust conversations about why we encounter some of the problems that we have in sex. Is it centered on the expectation? Or is it centered on the environment that we live in? Is it centered on the stresses that we are managing and navigating? And because we haven't been given the skills to manage that, it's manifesting itself sexually. And allowing people to have those thoughts versus immediately pathologizing themselves. That would be my dream.
Yeah, yeah, you're so right that, we all of a sudden, people and everyone, I think, starts to internalize the problems that they may be experiencing, and without realizing that it's really not a function of them. It could be something that they've experienced in the past, or all their negative thoughts, or the media and things like that. And that's why I think it's so important the way that you talk about it with the sexological systems, because then you break it down into, why are you having this? And if it has more to do with thoughts, or does it actually have like a biological component to it? And like you said, it could be all of those things, right? And that's why you work in a collaborative team effort. But that it's important to realize what are the dysfunctions, and then where do they stem from.
Absolutely.
Yeah.
Absolutely.
Yeah. So you know what I'd love to know, actually. I just discovered, and I think I mentioned to you that your Instagram page, and
Yes.
I think it is awesome.
Thank
And
you.
I'd love for
Thank
you to
you so
talk
much.
to us a little bit about it, and what your hopes are in terms of, the content that you put out for your Instagram page.
Thank you for asking that question. It's so funny. When I started Instagram, I really wasn't a social media person. I didn't understand it. I was like, how does this work exactly? What's the
Yeah.
goal? But I wanted people to have, I wanted to give people some ways to access sex education or sexual health information in a way that was comfortable to them, that was similar to their own backyard. And so I created content around the issues that I was seeing in the clinic that
Mm,
my colleagues and I were researching.
sure.
And so I think some of the first posts were about erectile dysfunction,
Hmm.
because I was getting so many patients coming in, and they were really young, under 30, with erectile issues.
Oh, wow.
And I kept saying the same thing over and over and over and over again. And I thought to myself, okay, like let's talk about this. And so, I just started just talking. And then I thought, well, I always wanted UC Logic, that's my brand, to be authentically real, and to talk about the real things that are happening in the world, and to not pretend that, sex is happening in a vacuum,
Mhm.
because it doesn't.
Yeah.
That's not a thing. And so I developed uh, this thing called swagger tips. So tips to just be a human in the world, but then also tips about sex, and how to be yourself, and how to not, I think one of the tips was about, not trying to copy, like, we're comparing ourselves to other people's, like, oh, so and so has this sex life and so has this sex life, what's wrong with me? And like, comparison is like a tranquilizer dart to your sexy swagger, to your confidence. you know
Yeah,
because it just does. Or that your experience, right, is going to be a truth teller, right?
absolutely.
Your libido
Yeah,
is a truth teller,
absolutely.
right? Because if your libido is tanking, you're like, I don't know what's going on, but it's telling you something, right? We need to be able to like tune into that and listen to that. We still, of course, want to make sure that we're screened and checked out, and all of those things, but like really examining. So it's my social media has always been a biopsychosocial approach. I just didn't say it. I was starting to kind of teach people. I start thinking about, yes, we want to look at, you want to make sure you talk to your doctor, and definitely see an endocrine specialist, but in the interim, while you're waiting for that appointment, let's do some work about what were the first sexual messages you got, right?
Right.
How are you supposed to be this hypersexual being when it wasn't discussed? And we're
Right.
not pathologizing the fact that it wasn't discussed. We're just saying it wasn't discussed. Therefore, we need to practice a way where it can be discussed, or you can create a level of comfort so that it works for you
Absolutely.
in your life.
Absolutely. And I agree with that 100% in terms of, not discussing it, right? So how do we go from that sex negativity to that sex positivity?
Mhm. Yeah.
Right, where we can have those discussions, and at some level, if you're very new to it or whatever, it's going to be uncomfortable, right? But then you discuss things like that, things that may be sensitive, in a very safe environment with people that you trust, so that you feel more comfortable discussing those topics and things that may be bothering you, right? And I think that that is very, very important, to create that sex positivity. And so that's part of the reason why I love your, Instagram page, because there is a lot of that, and that's really a lot of things, that you focus on as well.
Yeah, absolutely. I think what I also do something called bourbon tales. So
Yeah, I saw that.
I
It's
love
cute.
bourbon, but I sip bourbon and answer people's questions about sex, and it's all types of questions, and I try, and they're all follower based generated. So I just de-identify it and just take the gist of the question and answer it for the general consumption. And I think that that's my opportunity to kind of to give people specific tips and say, okay, so you're thinking that you're being sexually stereotyped by this person that you're dating. Well, okay, so here's some steps to take to inquire about that and to understand that more, right? It's not that I'm telling them this is the solution for all, but these are ways to think about it. But then also with the question, introducing a concept that may not be in the brain space of a lot of people.
Yeah.
So in the question is the education.
Right. Right.
Yeah.
And I think what's great is that you give people, um, ways to talk about uncomfortable topics. And, I think, perhaps segues into their conversation. I get the question, like, how do I even bring up this topic with, my spouse that I've been married to for 20 years? How do we bring up a conversation that we've never had about, our sex life or our intimacy? Where does that even begin? How do I start that conversation?
Yeah.
Right. So I think that that's really important, is finding where your comfort level is and becoming comfortable, and so that you can have those difficult conversations.
I love what you say. I love what you're saying about understanding your comfort level, because I think we also forget that depending on the situation that you're in, right, or how your family is constructed, or how your relationship is, a lot of times we attach our sexual development to our partner, right? It's very much intrinsically linked, right? But then we have to remember that that's something that, like, you have your sexuality, your partner has their sexuality, and then you create one together.
Yeah.
And so sometimes it's hard to separate. And so I often tell people, don't think of it as separating, because that, like, what you built with your husband, your wife, is beautiful and sacred and awesome. And it's just that means that, oh, you're just taking a minute to think about, okay, so your sexual desires, your sexual sensitivities, those are evolving. And so you want to think about, okay, how are they evolving? What is it that I need?
Yeah.
Oh, I didn't used to need as much, verbal engagement or communication beforehand. But now I'm feeling like I need that, right? So starting centrally there, where it's not a failure of your partner or a failure of you. It's almost like, oh, this is I'm growing and evolving, and I want to share this with you.
Yeah.
And I want
Yeah.
to invite you in. Is there some are you noticing that you're growing and evolving? And kind of like, I think you may have heard me say this abundance mindset,
Yeah.
where it's less about something wrong and there's a deficit that needs to be filled. It's more that you're kind of moving along in life, and the things that you responded to are changing, or maybe you never responded to it,
Yeah.
and then you're just discovering what you are responding to.
Absolutely, absolutely. And I think that's so true when you talked a little bit about growing with your spouse or even just growing on your own. I think that, sometimes when you don't have that much experience, right? And you come from a culture or religion, your religious practices where you're not supposed to have that type of experience, right? Until after you get married. But
Absolutely.
then you realize that just what you're talking about, that it's not a deficit. It's not a downfall of anyone or anything, but it's more of an opportunity for you to grow and learn about each other, but learn also about yourself
Mhm.
and to see it as that. And just by reframing it, right, it takes it from something that's very negative to something that's very positive. And and then working on that and then working on yourself. I think that that is very important.
Absolutely, absolutely.
Yeah.
Because I had a lot of patients and clients where, the first encounter was with their husband or wife, and they're like, and they're learning. Like,
Yeah.
that's when sex ed began. And I'm like,
Yeah.
fabulous. This is a great opportunity. Right? Here are some resources. Here are some things that we can jump into. Here's some pleasure mapping you can do with each other, right? You can discover a lot of things, and it can be really exciting, right? And just because something may not feel good to another person, it's not a failure. It's not a failure of your skill, right? It's not about your skill. It's about what you both are discovering and understanding, you know, that ebb and flow with
Right.
one another.
Absolutely.
Yeah.
I can't, I definitely can't let you go without talking a little bit about vaginismus,
Yes, of
for
course.
therapist. I have the luxury of having on with me. And so, you know, talk to the viewers and the listeners about who may be suffering from vaginismus, a little bit about what they can do. And, I talked about it a few times in my podcast, but I'd love to hear your thoughts. And, maybe if you could just tell our viewers again, just what it is again, and talk a little bit about that.
Absolutely. So, and forgive me, I'm just going to go into the pelvic floor for
Yes,
13
please.
seconds.
Absolutely. I'd love it. I'd love
Just to
that.
make sure that everyone's on the same page. So,
Awesome.
so the pelvic floor are the muscles at the bottom of the pelvis, and we're going to see this in all genders. So it's not just for women; it's for everybody. And so the pelvic floor goes from your pubic bone in the front all the way to your coccyx in the back, and it holds up your all of your organs, right? Bladder, uterus, prostate, everything, rectum. And then also what it does is it helps you with urination, defecation, sexy time, and babies if you so choose. But one thing people always forget is that the pelvic floor is a stabilizer. So it stabilizes the pelvis, it stabilizes the hip, it stabilizes the spine. And it's a skeletal muscle, so you have control over it. So you can contract it, you can relax it, and you can lengthen it. So when we're thinking about vaginismus, right, we're thinking about the pelvic floor muscles and for people with vaginas and vulvas. So the vaginismus occurs when the muscles are so tight that nothing can go in, or something can go in but it's extremely tight and it's extremely painful, so that you can't have penetrative intercourse, or you can't have a pelvic exam using a speculum, or you can't insert a tampon, or you can't insert a diva cup or whatever, menstrual cup or whatever, so nothing can go in, and it can be really really devastating. And oftentimes what we're seeing is that it's usually the cause of this is where people, it's not clear. There's a wide range of things, but it actually has been shockingly poorly associated with sexual trauma. So a lot of people assume that that's the direct piece, but that's not the piece. Now, when we're thinking about how do we manage this, right? And so people say, well, how do I know if I have vaginismus? Well, usually it's going to be a combination of a pelvic floor assessment and the subjective interview. So oftentimes I'll ask people, are you having pain with penetrative sex in the vagina? Right? And if they say yes, and they're like, actually, nothing can fit, not even a finger, not even a pinky. I'm like, okay. And so if we do the exam and that's confirmed, usually that's when I see that. And so the first thing I want people to understand is that this happens more often than you think.
Yeah.
This happens more often than you think. And that the first intervention is not immediately to, I mean, dilators are part of it, but you have to be ready for that. And not just physically ready, but emotionally ready.
Uh,
And it has to be prescribed in a way that works for you as a person, as the individual in your life. So for example, for a lot of my patients, we start with just thinking about the process of the sexual cycle. I said, what do you feel when you're getting aroused? Are you present in your body? Do you feel tension? Right? And having them recognize that. And if they say, oh, wow, arousal is when I start to feel tightness down
mhm.
there, that's where I'm going to focus. We
Yeah.
might start with belly breathing. We might start with, kind of doing an abdominal massage during that time to kind of get your body desensitized. So it's not, so your vagina and your vulva aren't thinking stranger danger. Right? We
Right.
want to kind of ease your body and coax your body into that, massaging your thighs, those types of things. You can incorporate your partner into this, right? So then that foreplay aspect or the arousal aspect can really be helpful for your body to actually feel relaxed, right? Safe. Now, vaginismus or the intervention for vaginismus can works best with multiple interventions. So you might be using, and this is where you come in, where you prescribing, muscle vaginal relax or muscle relaxers. You could use anything from baclofen to Valium to Botox to injections, you name it. There are lots of ways that you can do. You can stage that, but I always start with doing something that's non-invasive and to see how that works. Because if we can get you into using, even, you don't even have to use a dilator. If you feel comfortable, you can use your own finger. You can use your partner's finger. You can use a vibrator if you feel comfortable with that. You can use, lots of devices that can be utilized to help with this process so it doesn't feel so intimidating and scary, right?
Yeah.
And another, and I also like to use a lot of interventions like yoga positions and movements to kind of help open up the pelvic floor, prepare the pelvic floor, and with the goal of just getting your body to feel comfortable and safe and ready for sexual play. But another huge thing that is often getting missed with this is expectation management.
Yeah.
Expectation management. And so the realistic thing is that for the most part, it takes about anywhere on average 3 to 6 months for conservative management to really start to take effect, and that requires a lot of stamina,
Yeah.
right, and patience, and education. But during that time, it's not that you're taking baby steps. It's that time where you're actually growing sexually, because then I said it's that opportunity time. It's like, okay, so in the meantime, while we're working on this, there's so many other ways to be sexual.
Right.
There's so many other ways to be close with your partner, to feel to feel close in that intimate space with your partner and sexual space with your partner, right? Communication can be developed. You could develop new skills, new activities, techniques that can be really, really satisfying for you and your partner as you're working on this.
Absolutely.
Yeah,
Absolutely. Yeah. No, I think that's awesome. I love how you bring in all the different modalities. And one of my favorite speakers that I've heard, and I'm not sure if you've heard of her, but Dr. Uloko. She does sexual medicine in San Diego, and she also talks about how the brain is the biggest sexual organ.
it is.
And I think, like with vaginismus, the brain plays such a huge part, right, in terms of what the brain is thinking when, just like what you said, right, when arousal happens, what happens to you,
Mhm.
right, when you start to have a sexual encounter, what happens, and what are you thinking of, and are you present, are you not present, and what's going on. And I think that that is such a huge component with vaginismus, that it doesn't really matter how many dilators or how many mechanical items you have. It really depends on what's happening in your brain and what your thoughts are.
Absolutely. And I mean, I would say, like, here's like a three-step thing for people if they have vaginismus to think about.
Yeah.
First question is, what do you feel in your body when you just think about sex? Recognize that. What did you feel? Do you feel tension in your toes? Do you feel tension in your shoulders? Do you feel relaxation? Do you feel sick? What are you physically feeling? And what are you emotionally feeling, right? And
Yeah.
what are you feeling during that arousal phase? What does your mind go through? What does your body go through? And then I want people to think about what would they like to feel?
Mm,
I would
yeah.
start with those steps first, because then when you have that information, it's actually very straightforward to design even an intervention that's specific to you. So, depending on what you say, I might recommend, okay, actually, I want you to do some hands and knees rocking with some cobra pose. And I want you to massage your inner thighs every night. And I want your partner to do that with you.
Right.
Right. And another person, I might say, okay, I'm going to have you consult with our urologist or urogynecologist or, vulvar specialist. We're going to see what medications we need depending on the patient. Some people will be like, oh yeah, I think you're ready for dilators. Oh,
Right.
the concept of dilators makes you uncomfortable. Okay, what would make you comfortable? Would you be comfortable with your fingers? Do you have something at home that you would like to use? And then take it from there.
Right. Right. No, that's awesome. And I'm so glad that you walked us through that, because I think that, some people might think that it's a one size fits all, right? No pun intended. But
Right.
I mean, it's, you just have to see what works for you and where you are, and where are you starting from, right? What's the starting point and where do you want to get to? And then how would we get there? What are the steps we need to take to get to that point where you feel comfortable in in an intimate setting, in a sexual relationship. And I think that those are all very, very valuable insights and important things to note. So thank you so much. So what if somebody wanted to get in touch with you, or follow your Instagram, or see the products that you have? How could they find out, and how could they get in touch with you?
Absolutely. You can get me on my website, www.uclogic.com, where you can get my book, where I have a guide to sexy swagger, reimagining your sex life for women and vulva owners. You can also book a private session with me. You can follow me on Instagram, Twitter, or Facebook at UCLogic, or you can email me at info@UCLogic.
Awesome. Well, thank you so, so much. And it was completely my pleasure to have you on. And you are a wealth of knowledge. And to all the viewers and listeners out there, this isn't even the tip of the iceberg. Dr. UC has so much information and is just so full of knowledge that you just can't get enough. In fact, everyone should go and start to follow her on Instagram, because she is amazing. So thank you so much. Thank you
Thank
for
you.
coming on. And well, I am done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So please see your healthcare provider if you have any concerns about your health. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.